Jerwil Salvador is a COVID-19 survivor. He spent weeks in hospital in a critical condition, and he says he spent his life savings, a few $100s, on medicines. He's now without a job, and despite reports a vaccine against coronavirus will be available early next year, he's not confident his family will get access to them.
Yung SAP nga lang, hindi pa nila mabigay sa amin.
You know, I didn't even get any cash aid this entire time. So I don't even think a vaccine is something we'll get either. I just worry about my children. That's all I care about.
The Salvadors live in Payatas, one of the poorest communities in Manila, the center of the pandemic in the Philippines. There are some people here, however, who don't share Jerwil's pessimism and are hopeful the vaccines will signal a return to normality.
Poorest of the poor, marami po.
Our residents belong to the poorest sector of society. We, the government workers, are looking forward to this vaccine, hoping will be made a priority.
The government aims to vaccinate at least 60% of the country's population in order to achieve herd immunity. But in an archipelago of more than 7,100 islands and a national budget that's barely enough, even officials here admit it won't be easy.
For weeks now, countries around the world have been trying to secure deals to buy vaccines when they become available. Wealthier countries are bidding for a huge share of supplies, hoping to vaccinate their entire populations. But the United Nations says 2/3 of the global populations will not get enough. And many countries, including the Philippines, do not have the logistical support to establish an adequate vaccination program. They also don't have the capacity to produce their own vaccines. Officials here say they hope that taking part in phase 3 trials and joining initiatives with other less developed countries, they may be able to procure enough doses.
The priority is our frontliners. The 50% that will be dedicated for the government will be given to the priority sectors, and particularly our health workers and our poor and vulnerable communities. While 50% that be given to the private sector will also be given to their frontliners, low-income laborers, to give fair access.
In its ability to contain the virus in Southeast Asia over the past few months, the Philippines is seen as the worst performing country. And many here fear it will also find itself on the bottom of the list for the vaccine.